Greetings and welcome everyone to another episode of Oral Pathology Tuesdays. 1 billion of the world's population, or 19% of the world's population, are affected by periodontal disease. It's one of the most common, or the six most common NCDs that are right now featured very highly on the overall health and the health goal of the WHO and the world. Today, that's what we're going to be talking about. Today, we're dealing with periodontal disease with Dr. Gauri SarDessai. But before we do that, let me just share some information with you all. Um, it's also because for a moment she's got disconnected. So until she comes back, I will just give you all this bit of information. The first thing, of course, is that we have our community, as you know, on YouTube. And if you join us, if you can connect, it will help support our activities. As you know, Oral Pathology 360 is a non-profit. So it would help, and it will help support everything that we do and bring you more and keep doing more. So that is one thing. One of the ways you can do it is by clicking the join button right below the video, and you can find the details. If you can join, lovely. If you can't, it's okay too. And you can definitely subscribe if you have not subscribed. Another thing is we have now a number of okay, we have a number of contests going on right now. Among those is the open mic contest, which is there are two simultaneously happening. One is for the students, that is whether undergraduate, postgraduate, or a PhD student, and one is for faculty. By faculty, I don't mean that it needs to be someone who is working in a college. Anybody who is not a student. Let's just put it simply like that. The last dates are, one is for the students. The last date for submission or for and making an entry is the July 28th, and for the faculty one it is the July 25th. Both are very interesting. You can find a lot of details. If you scan that QR code, you can find out. You always, very often I hear people saying that I haven't had an opportunity to really, I can do so much more. I can, speak. I'm good at public speaking. There is so much that you can do. Well, this is the chance to actually test it out and do the needful. So do definitely join. Check it out. And the one for students actually gives you a chance to get undergraduate students interested in our topics, whether that's oral medicine, oral pathology, oral radiology, anything. And basically, it is open to the contest is open to anyone within dentistry, medicine, allied health sciences, anybody. And if you're guiding a student, you will also get a certificate along with the student. And of course, if you're faculty, well, you're just doing it on your own, and you get the chance to, possibly the winner will get a chance to present a lecture on the channel. And also three winners, because we will have this three times during the year. The three winners will have a standoff against each other, from where we will choose the next rising star who is going to be taking part uh, in our annual conference, International Oral Diseases Case Presentation Conference 25, and will be the rising star will be a guest speaker there. Okay, I can see our guest is back. Yes, hello and welcome, Dr. Gauri.
Yeah, hi. Good afternoon, everyone.
Good afternoon. Of course, it's good you made it back. So, everybody, today our guest is Dr. Gauri SarDessai from Goa Dental College. It's a great privilege to have her here, and this is the third one of our lectures on periodontics. So, I will let her, instead of like I promised in the last town hall, that we will have a little more focus on the possibility of interactions and collaborations, for which, of course, you need to know what are her interests. So I will let her tell you a few words about what her interests are.
So, good afternoon, my dear colleagues and my dear friends. So, to begin with, I would like to just brief you all up that I like to treat patients, I like to examine patients, I like to do the investigations, and I like to have open discussions. Now, for us to treat patients that come to our department of periodontics, we need to interact with other specialities too, which really play a big role in in helping us with diagnosing our conditions, the periodontal conditions. And that's what I will be speaking on today. So, a very warm welcome to you all. Thank you.
Thank you so much. Okay, with that short introduction, let's go and listen to the lecture. And hi, Anupama, and hi, Dr. Madhura. So, welcome. We will listen to the lecture and we will come back. Where is the lecture? Okay, my order got a little mixed up. Now, here it is.
Good afternoon, one and all. Myself, Dr. Gauri SarDessai, presenting Transforming Periodontics, the power of oral and maxillofacial diagnostics. Have you ever heard the saying, together everyone achieves more? If you look closely at the saying, you'll note it creates the acronym TEAM. What problems could poor dental health cause? As we know, heart disease, mouth cancer, strokes, lung conditions, diabetes, to name a few. Periodontitis, being one of the most common oral dental health condition, is a chronic multifactorial infection of the periodontium affecting soft and mineralized tissues surrounding the teeth. And like any other disease, the earlier it is diagnosed, the better is the prognosis. A precise oral and gingival examination, along with intraoral radiographs, occlusal, bite wing, and periapical, along with cone beam computer tomography, are primarily good enough to reveal caries, periodontal, and periapical diseases, whereas the other conditions involving jaws and temporomandibular joint can be assessed using extraoral radiographs. There are certain rare pathologies that normally manifest in soft or hard tissue components of the periodontium. When periodontists, along with oral and maxillofacial pathologists, act cohesively in a convenient way, these pathological conditions can be perfectly diagnosed and treated. Not all possible disease processes that affect the gums could be included, but it will facilitate a structure to steer the investigations and treatment plan if something abnormal is identified. What is diagnosis? It is the process of identifying a disease, condition, or injury from its signs and symptoms. A systemic history with a good clinical examination, along with blood tests, imaging tests, and biopsies, may be used to help make a diagnosis. Now, at times, if the diagnosis is wrong, there can be diagnostic errors. It is defined by the National Academy of Medicine in 2015 as the failure to establish an accurate and timely explanation of the patient's health problems or communicate that explanation to the patient. Given that many diagnostic errors are caused by subtle biases in clinicians' thought processes, some diagnostic errors may be prevented by systems to mitigate the effect of these biases and provide physicians and dentists with objective information to assist with decision making. Thus, working as a team is what helps in proper diagnosis and preventing diagnostic errors. Periodontal and gingival changes are known to occur due to many conditions, a few of them being poor oral hygiene, systemic factors, inadequate nutrition, stress, hormonal changes, malignancies, to name a few. What are the systemic factors? An unhealthy diet, stress, diabetes, gingival growths which are due to malignancies, and hormonal changes which are seen in a woman's lifetime. The importance of good nutrition has been well established as it reduces the risk of diseases like heart diseases, cancer, stroke, osteoporosis, etc. It also improves your well being, improves your immunity to fight off the illnesses, improves your ability to recover from injuries or illnesses, and increases your energy levels. Believe in yourself and stick to that healthy diet. Your body will thank you later. A diet that makes you sick day in and day out is not a diet that you should follow. Make love with juicy fruits and vegetables. Now, what happens when there is a deficiency in vitamin C intake? As we can see, the gingiva gets inflamed, enlarged, erythematous, and it bleeds easily. A diet rich in vitamin C, as we can see over here, helps to prevent such changes in the gingiva by giving adequate amount of vitamin C to the individual. Another thing which is very commonly seen today is the deficiency of vitamin B12, which can be prevented by consuming diet which have the natural sources of vitamin B12. One more thing that is very frequently observed is iron deficiency, and patients come complaining of bleeding gums. In general, what we see is it is common in females in our Indian population. A good history, along with inquiring with the patient about the consumption of foods rich in iron, and a hematological examination helps reveal to us that the patient is having iron deficiency. As we can observe over here, the oral hygiene is comparatively good, but the gingiva is enlarged, inflamed, and appears reddish, that is, bleeding. Hematology tests helps us to confirm the diagnosis. And if patient is asked to consume iron-rich foods, and as we can appreciate here, the change in the gingiva after consumption of iron-rich foods. What we also see is Fanconi's anemia, a rare inherited bone marrow syndrome which presents itself clinically with inflamed gingiva. Also, it is common to see changes in the gingiva in aplastic anemia. Now, we get a lot of female patients, especially in females. They come with the complaint of burning sensation or inflamed gingiva. Desquamative gingivitis is a peculiar condition characterized by intense erythema, desquamation, and ulceration of free and attached gingiva. It is not a specific disease, but a gingival response manifested by a variety of clinical disease entities, a few of them being pemphigus vulgaris, bullous pemphigoid, oral lichen planus, and lupus erythematosus, to name a few. Patients normally complain of burning sensation of the gums, along with chronic soreness with the intake of spicy foods. Many a times, the patients may have no symptoms. It's not a disease entity, but a clinical term for persistently sore, glazed, and red or ulcerated gingiva. A periodontist will be called or a patient referred to a periodontist to manage a non-plaque related mucocutaneous disorders, either alone or as a part of treatment team consisting of physicians, dentists, or either allied healthcare professionals. A detailed systemic and dental history, along with clinical examination, helps in the provisional diagnosis. Since it's not a disease entity but a clinical term, various causes have to be ruled out, like stress, diabetes, hormonal changes, along with contact allergic reactions to various oral hygiene products and chemical agents like dentrifices, mouthwashes. As we can clearly appreciate over here, we can see gingival changes on teeth with comparatively good oral hygiene. And over here, we can appreciate changes in the gingiva with comparatively good oral hygiene and the presence of ulcer. The histopathologic shows us subepithelial connective tissues along with chronic inflammatory cells like the plasma cells. Now, in systemic lupus erythematosus too, there will be such gingival changes along with the presence of an ulcer. It's the histopathological examination that confirms the diagnosis of the actual disease. There are other systemic conditions that also present themselves in the gingiva, one of them being leukemia. Specifically, over 30% of individuals who are diagnosed with leukemia experience various oral manifestations. The most commonly observed findings include gingival hypertrophy, spontaneous bleeding, petechiae ulcerations, and oral mucosa pallor, as is observed over here. Among females, what is very common throughout her lifetime are hormonal changes, which may produce an exaggerated inflammatory response to dental plaque resulting in gingivitis. Dental plaque deposition and highly inflammatory gingiva, bleeding, and redness are typical features of hormone associated gingivitis, as we can observe over here. And also in pregnancy, it is very common in the even when the oral hygiene is good, to see a pregnancy tumor, which is confirmed by histopathological examination. Many times, gingiva can present itself with different kinds of individual growths. Many look similar, but its histopathology confirms the diagnosis, like peripheral giant cell granuloma, pyogenic granuloma, peripheral ossifying fibroma, squamous cell carcinoma. A differential diagnosis will be given to any gingival nodular lesion, and it's once again the histopathology that confirms the diagnosis. At times on the gingiva, there appears a blackish growth. It does get quite alarming. Can be a nevus or a malignant melanoma or a melanocytic papule or even a tattoo, as we can see over here. One patient had reported to us with a discolored patch on the labial surface of mandibular right, with respect to the mandibular right canine, as we can see over here. Excisional biopsy was advised and done, and the histopathology confirmed the diagnosis to be intramucosal nevus. In another case, one more young patient had reported with a complaint of inflamed gums. Oral examination revealed inflamed and enlarged gingiva with comparatively satisfactory oral hygiene. Patient had speech difficulty along with intellectual disability. OPG was advised along with oral prophylaxis. The OPG, as we can see over here, shows arc-shaped bone loss distal to mandibular right first molar and mesial to mandibular left second molar. We can also appreciate the increase in the cortication of the alveolar crest. Thus, it was decided to get we can see a histopathology examination done of distal to the mandibular left first molar, and an excisional biopsy was done along with a immunohistochemistry of the enlarged gingiva and a provisional diagnosis of IgG4 related disease was given. Further investigations are still awaited. There was one more case wherein a young patient presented with discomfort with respect to mandibular right first molar. Examination revealed a good oral hygiene with no periodontal pockets, as we can see over here. IOP X-ray was taken, which revealed endodontic treatment of second premolar and first molar, along with considerable bone loss in the furcation. CBCT was advised to confirm the diagnosis and thus the need to repeat endodontic treatment prior to carrying out the necessary periodontal treatment was advised, as the communication of the radiolucency from the apical region of second premolar to the furcation of the first molar was clearly evident. To conclude, as we have observed, diagnosis of many periodontal conditions can be appropriate with oral and maxillofacial diagnostics. And evidence-based periodontics has made us understand that most of the patients having various dental or medical treatment requirements require multidisciplinary approach rather than a personalized periodontal approach. Periodontal clinic is thus a hub for interdisciplinary approach. Interdisciplinary teamwork in periodontics is a complex process in which different specialties staff work together to share expertise, knowledge, and skills to impact on the patient care. Thus, the interdisciplinary periodontics can be interpreted as the interaction and interrelationship between periodontists and other dental specialists with harmonious setting and skills, sharing common periodontal health goals and practicing physical and mental effort in determining, planning, and evaluating patient care. Thus, the proverb says, iron sharpens iron, and one man sharpens another. Thank you.
Thank you. That was what I would say, a good cover of all the common pathologies that affect periodontia. So, I have one question for you, and that is, how often do you actually send any, let's say you excise gingiva, or you have any tissue like that? How often does your department send it for pathology examination?
Well, these we get patients with different kinds of growths or enlargement on the gingiva, and maybe in a week, at least once a week, definitely,
Okay.
at times twice a week. but once a week, definitely yes. The need arises to do so.
Mm, that is true. It's very interesting.
And,
Actually, we
and
don't
apart
really
from
talk
that,
about it
yes,
often.
yeah, and one more thing we have seen is the prevalence of desquamative gingivitis among women is become very high. And especially we have noticed that there are certain seasons, like the summer season in Goa, is when the prevalence of the occurrence of the cases of desquamative gingivitis increase.
That is
Like
very
patients
interesting.
do come complaining that I'm getting burning sensation in the gums, my gums are enlarged, or rather there is bleeding from the gums. And on observation we realized that like we give a provisional diagnosis of desquamative gingivitis, and many a times a need arises for us to do the incisional biopsy to know what kind of disease it is.
Right. Have you been able to find out anything that points to why there is a seasonal prevalence as such?
Oh,
Any
not yet,
theories?
but we have noticed of we have noticed of late. We were just observing, is compared to what we see during our winter, like that's around November, December, and compared to what we see now at this time. At this time, I mean to say around April, May is the time when our cases have increased.
Very interesting. Of course, for everyone who
Yes,
does not know what the
and
weather in Goa
stress.
is, it is hot, hotter,
Yeah,
and hottest. But
it's
yeah, there's
absolutely
no
what we
actual
have is
cold
we
season.
call it winter. No, we
Yes,
don't. Though it is called as winter, but it is never a winter.
it's never a
It's
winter. It's just
summer 20.
pleasant.
Yeah, it's always it's
Yeah,
pleasant.
it's pleasant in the winter. So, but this is very interesting. Have you ever found out whether it is in some way connected? Sorry. Oh no. Okay. We lost Dr. Gauri for the minute, and she will be back. Yes. So, for people who joined us, Dr. Bhuvan has joined us late, and I mean, rather later than others, and Dr. Varun have joined. Yes. Hello, both of you. Nice to have you here. And this is particularly interesting. I think the fact that it should be seasonal is really an amazing thing. I truly do wonder, and I hope somebody works on it and finds out why exactly there she's back. Are you back, Dr. Sardesai? Okay, not yet. We'll get there. Right. So, any of you have any questions? Of course, if it's very periodontics related, I will not be right to answer it, but hopefully she'll be back to answer it. So, what did you all think of the beginning 2 minute video? Normally, the waiting video, I have changed it. Before, it used to be all about, you know, at the hour, that 2 minute video, a countdown timer used to be a scenery and music, basically. Then I thought we might as well just share with you information about what all is happening. How did you all like the video today? You can let me know. Yes, thank you. Yes, that was an informative presentation. It's um, it's interesting to have topics that are out of our regular ballpark. Although I guess, truthfully speaking, it is never really, nothing is out of pathology or oral medicine for that matter, because I guess we just have to know it. But there is so much to know, so it's good to get one of the experts to come and tell us what it is, what they face. Dr. Bhuvan, I will wait till she comes and then I will share that question. And I hope she comes. So, actually, periodontitis, I think, although in a lot of ways very simple to understand, I mean, it's very easy to understand why inflammation or anything going wrong with the with the periodontium is definitely going to be bad news for the teeth. And the complexity of the structures, I mean, nowhere else in the body do you have uh, anything piercing soft tissue and going right into the bone. So, teeth really bring about an interesting situation there, which is totally unique and not there anywhere else. But uh, much as we can understand the why, I think one of it is still relatively very difficult to treat it. The how to treat is still quite complex in a lot of times, and a lot of types of periodontitis really just sadly go on in spite of treatment. Of course, I have to accept my knowledge and this is outdated, so I will wait till she comes back and we can ask her. But the last I knew was that there were quite a bit of periodontitis that really was not I would say is treatable, in the sense we can manage to some extent, but is not really curable. So that's a very interesting part. I've always found very interesting as far as periodontitis goes. Dr. Bhuvan, how often do you get samples from periodontium? Since you are here and I know you are running your there. Okay. So I will bring this. Dr. Bhuvan says, I do see a lot of tuberculosis cases presenting as cervical lymphadenopathy. Okay, this is again for her. In your experience, how often you see tuberculosis presenting as gingivitis as a manifestation? Hmm. Well, years ago, and this was, of course, just one case. I can't really comment in the long run. But years ago, we had a case that basically started in the mucosa, not gingiva. It spread to the gingiva, but it started in the mucosa. And everyone was very convinced that it's an oral cancer, but it wasn't. And we could manage to find that the patient did not have, to begin with, did not have an involvement of the lung, which we expect for primary tuberculosis and then for it to spread, but it had somehow skipped and had come to the jaws first. And only during the time when we were basically, we kept looking at it, and histopathology was obviously not showing anything that looked like tuberculosis, and it was in fact a very clear cut case of squamous cell. I mean, it was showing tuberculosis and not squamous cell carcinoma. So we finally did the test and we found that positive. By that time, then when we did the chest X-ray, then the chest X-ray was positive, and then of course patient could be treated. So that was the thing. Oh, thank you, Bhuvan. Yes, yes. He says the video is nice. Thank you. Let me hide this. I don't want. I do wonder whether she can join us or what is happening. Mm, what can I do? You're back? Okay. But I can't hear
Because
you.
somehow today, yeah, can't you hear me?
Now I can hear you. Now I can hear you.
Yeah,
Okay.
yeah, 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 yeah. I'm very sorry because suddenly there are four networks. We have been trying different, but we just couldn't get through. I'm very sorry about. Yeah,
Okay. I was just trying to see how I could modify this. There's a feedback. Someone else close to you, someone
yeah.
is watching it on YouTube. You can tell them to move, I think. Okay. So right. So I have a question for you.
Yes,
Right.
yes,
Dr.
yes.
Bhuvan Nagpal is asking how frequent strawberry gingivitis as a manifestation of systemic disease is encountered.
This is not very frequently. We haven't seen many of these.
Okay. And then
Yeah.
we have one more that is about tuberculosis. Yeah, Dr. Nagpal is
Yes, in
asking.
fact,
Yeah.
we did have one patient, a young boy at one time, wherein he did present with gingival enlargement. And on taking a good medical history, he did reveal that he had tuberculosis when he was small, but his treatment was incomplete. And then we systemically he was fine, but then he decided to do an incisional biopsy of the gingiva, and it was diagnosed to be due to tuberculosis. It was a the gingival enlargement was because of tuberculosis. Thereafter, the complete test was done, and the entire treatment for tuberculosis was complete, and the gingiva resolved back to the normal gingiva.
That is very nice. Yes.
Yes.
Okay, we don't have
And there
any
are
more
times when we
questions.
have diagnosed leukemia too clinically by doing the blood test with the appearance of the gingiva, with the kind of enlargement, the bleeding.
Yes, color. True.
Yes, yes, yes,
It is.
yes.
Yeah. Yeah.
Yeah.
Leukemia, I think, is one of I mean, textbook wise, I have never come across one, but
No, we
textbook
have
wise,
come
it's
across.
very
Yes.
typical that
Absolutely.
presentation. Yeah.
Yes, yes. We do get a lot of, as I mentioned, iron deficiency due to iron deficiency, vitamin C deficiency, and even vitamin B12. That's the reason why I mentioned these three in the talk that I gave.
Yes.
Yes.
Very true.
And not to miss diabetes, the changes in the gingiva because of diabetes.
Very true. Are there
Yes.
any typical changes that you have come across more often, considering our population and diabetes? Any
Yes.
any particular changes that are more frequent in the gingiva?
Uh, Well, they come with the enlarged gingiva, with even the oral hygiene won't be that bad to correlate with the amount of gingival enlargement. There will be suppuration, there will be periodontal abscesses, and then, I mean, obviously, most of the patients we get their FBSL done and HbA1c. Even though the patients may say no, they aren't diabetics, but many times we diagnose them to be diabetics.
Right. Interesting. Now, I have one
Yes,
question since our audience doesn't
yes,
have much questions. So, let me ask you this. Now, we
yeah,
know this is just a theory, it's just a thought. We know that
yeah.
during COVID, or rather, COVID infections were causing the limits to literally skyrocket.
Yes.
Okay. So, did you find in people who had COVID that there was subsequently or soon afterwards more cases of periodontal abscesses or periodontal involvement or gingival involvement?
Yes, yes, because we always take a history, and we ask, "Did you have COVID?" And they say, "Yes, doctor, I have." When did you have? I had it 6 months back, or I had it a year back. And yes, truly enough, before doing intraoral examination, we take the systemic history. And then on intraoral examinations, we come to know that at least one area of periodontal abscess will be there.
It's very interesting.
And then we ask them, "Did you have the similar kinds of swellings elsewhere?" They say, "Yes, doctor, little swellings here and there." But what happens
Hmm.
is the periodontal condition per se is asymptomatic, and it
Yeah.
kills silently, or it destroys silently.
Silently.
Just like diabetes is a silent killer, periodontitis also destroys silently. So patients don't realize till their teeth are shaking, and
Yes.
at that sometimes it is too late.
Yeah, that's true.
Yeah. Or they come saying, "My mouth is smelling," because someone
Hmm.
else has told them that your mouth is smelling.
Quite. That is true.
Yes, yes.
This is very interesting. Yes. So
So
while
a lot
yeah,
of
yeah,
medical problems are correlated to the clinical appearance of the periodontium.
yeah, I think more and more we are finding that the whole body is really connected, and
Yes, yes, yes.
yeah. And I guess the periodontium, like I was just mentioning while you had been away, is that the whole structure, the complexity of the tissues in the mouth is unique. Nowhere
Yeah,
else do we
absolutely.
have,
Absolutely,
hard
yes.
tissue piercing through soft tissue, going into another hard tissue, and literally there's a passage right into the bone. So,
Absolutely.
and it just doesn't happen anywhere else. And that too in an
Yes.
environment which is, by its very proximity to the external world, is got
Yes,
so many
yes,
bacteria.
yes. And if you ask the number of species of organisms that are
Yes,
comfortably living inside, comfortably,
entirely, yes.
and we are comfortable with those organisms inside. And every time we open textbooks, new textbooks, we realize the number of
Yes,
species are increasing, but
absolutely.
comfortably living. They are all
Yes.
living comfortably.
Yeah, yeah. Each
Yes.
time there's an exponential growth in the number,
Absolutely, absolutely. Yes,
I
yes.
think
But it
more
is
than
those same organisms that at times can become pathogenic.
pathogenic. Yes, of course.
That is, first thing is our diabetes,
Yes,
followed by stress.
stress. Yes, and I
Yes.
guess the reduced salivation, that is a fallout of both of these things actually.
Yes,
Yeah,
absolutely. Yes. Does play a
that
big
makes a lot
role.
of difference. Yes.
Yes,
So
yes.
this has been an interesting presentation and an interesting discussion. I don't see any other questions. I do have Dr. Madhura who was saying informative presentation, and Dr. Bhuvan is saying thank you. And he said wonderful presentation.
Thank you.
So yes, it was a very interesting, and what I liked is that it covered those basics which we tend to forget, and it's
Yes.
sort of very important finally, if whether you are really in the clinic, dealing with the patients, or you are like us on the diagnostic side diagnosing the cases. But still, it is very important to remember that periodontium, the gingiva or periodontium, is an important place to look for cues as to what may be wrong.
Absolutely. Yes, and I must say, without good diagnosis, without good radiographs, and many a times without good histopathological examination with the hematological tests and the histopathological examination, we are not able to diagnose and treat many gingival conditions. And that
Very
is
true.
why that's where the importance of interdisciplinary dentistry does play a big role, and we have to
Very true.
work as a team so that we can be sure that we can do the best for the patients.
Very, very true. In a lot of ways, people feel that of course, now we know, as per definition, there are all the branches of dentistry are clinical. But if you think about the ones that are involved in the more, what I would say mainstream dentistry, literally, treating teeth or the periodontium, and us who are the diagnostic side, like oral pathology or oral medicine, a lot of times people feel that the diagnostic branches are really for a large tumor, a large cyst, something
Yes,
going seriously wrong. But in reality, even the very maintenance of what we do as dentists really requires this interaction, which is very often ignored. So I'm very glad you
absolutely,
picked up this topic. It was a
absolutely.
very good
Yes,
topic you
and
picked up.
diagnosis does play a key role in treating any condition.
True.
Yes,
I mean, it gives you a destination. A diagnosis, I
absolutely.
think,
Yes,
gives you a destination. And at the end of the day, anywhere you want to go, if you don't have a particular destination, you could be just going
we
here
reach
and there. And
nowhere.
yes,
Absolutely, we reach nowhere. We get
you could be
lost.
going round in circles.
Yes,
Yes.
absolutely. Yes,
So the
yes,
destination is essential, yes. And then you
yes,
can make the journey, the proper journey that would be required.
yes,
So
yes,
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 thank you so much. It was an
yes.
interesting lecture, and interesting observations that you shared with us. It was really nice. Let me share with you your little certificate. Thank you so much.
Thank you very much.
You're most welcome. It was a pleasure having you here, and I do hope people will get in touch
And
with
it's my
you and
pleasure too.
interact with you.
Yes, thank you very much.
Thank you so much.
Yeah.
So before we
And
go
pardon
away,
me for
let
being
me.
away for some time, it's because suddenly the connection was becoming a problem.
Yes, we have
Yeah.
come to realize that that happens, which is why now I
Yes.
take the lecture as a recording that gives us that, so that
Yes.
it
Absolutely.
goes,
Yes.
and that makes a
Yes.
lot of
Yes.
difference. Yes,
Yes. Yes.
this is
Yes.
technology. You can't help technology. You can
We
just
can't help it. Yeah.
prepare. Yeah. Prepare the
Yes.
best you can, but at the end of the day,
Yes.
there's some things cannot be helped.
Yeah.
Yes.
True.
It was very nice. So let me also share our next lecture is going to be, remember everybody, 2 weeks from now, not next week. Now oral pathology Tuesdays is twice a month, the second and the fourth Tuesday. So the upcoming lecture is going to be on the second Tuesday in July, and it is our first lecture welcoming oral surgery to oral pathology Tuesdays, because now oral surgery, of course, like I have mentioned, is, and as you can see, the little blade that has been added into our code of topics. So now oral surgery is actually a regular part of the disciplines that are included in Oral Pathology 360. And we are going to start it off with a very interesting talk. Dr. Sujata Mohanty is going to be sharing her experience of managing 25 years of odontogenic keratosis, which we always know is a much uh, discussed and disagreed and contentious topic. So this will be interesting because she is going to share her experience with us firsthand. And I do hope you will be joining us. Remember to, well, add it in your calendar and be there. With that, let me say thank you, everybody, for being here.
Thank you.
Thank you,
Yeah.
Dr. Gauri.
Thank you.
It was a
Yeah. Yeah.
pleasure.
Thank you. Yeah. My
Thank you.
pleasure too.
See you again soon.
Bye.
Bye. See you all, folks. See you after 2 weeks. Bye.
Yes. Bye.